Okay, so we are live, and just let me double check on Instagram as well. Okay, maybe not. Oh, it is. Just give me a second, Dr. Maureen. Just give me a
Okay,
second.
no problem.
Um, yeah. Ooh, very nice. Okay, welcome everybody. My name is Dr. Ashish, and we are live back with our Friday show. And I'm very happy it's consistently going out every Friday now, 12 till 1. And I always have an expert guest, another doctor consultant in the area who are doing amazing work in their own field so that we can have a chat and we raise information, we raise education about certain topics and health issues in our way, which is holistic way. So, Dr. Maureen, welcome to our show today, and it's so wonderful to see you here. And you are a consultant systemic psychologist. You have to tell me what what that
What that
is.
is.
Explain for us as well. But please
Yes.
tell us what you do.
Yes. Well, welcome everybody. As Dr. Ashish says, I'm a consultant systemic psychotherapist. And so I have worked for many years in the mental health field, both with children, so child and adolescent mental health, but also with adults, and run my own organization where we do all different kinds of therapy. But my professional expertise is in family therapy. So I can work with whole families, I can work with couples, individuals, and even organizations, because the systemic approach is very relational.
Yeah.
Alongside that, and before I trained as a systemic psychotherapist and clinical supervisor, I was a social worker in child and adolescent mental health. And many years ago, I was also working with very young children in private daycare as
Yeah.
well. So there's lots of years working with children and families in many different areas, basically. Yeah.
Yeah, but I think this systemic approach is almost like doing holistic work because you are looking at, the bigger picture. You're looking at
Yeah.
whole family. And what I can tell from my experience coming from Indian families that the family is not just only you and children. There is extended family, there are grandparents, there are other people
Yes.
who might be living together. So tell us about that, how, because it is, I always say, for example, even with fertility work or any other work like that, the whole family is affected. Yeah.
Absolutely. And that's, like you say, what a systemic approach is. It's very relational. It looks at the relationships between people, connections with ideas and theories and environments. So
Yeah.
it is very holistic in its approach anyway. In this society, in the UK, in the Western society, we're very much heavily weighted to a medical model of healing and healthcare. So, whilst we're not discounting that, but the medical model very much individualizes your healthcare journey, whereas the
Mm.
systemic approach widens it out so everybody is impacted. And so, for instance, for parents need to feel okay in their own emotional health and well-being in
Yeah.
order to parent effectively their children and young people.
Yeah.
If there's problems in the home, for example, to do with couple relationships, or if there's even problems to do with work, it can impact how you then are healthy in your mind, in your physical body even. So it is looking at the bigger picture.
Yeah. Yeah. And tell me the backstory. Why are you interested in this? Why do you do what you do?
Why do I do? Absolutely love what I do, and I have been doing
Yeah.
it for many years. And when I started, when I left school, actually, I started working with young children in day nurseries, and I went to work for an organisation that really looked at how children were being impacted by abuse, and I really got curious about not just working with the individual child, but I was curious about, what about if those parents and carers, and what about if, for some of those that were looked after, if foster carers were included in that healing process.
Yeah.
And it wasn't until I moved to a position after I qualified as a social worker in the CAMS field that I thought, and I worked alongside other family therapists, and that really kind of expanded my curiosity. And I thought, do you know what, this approach has something for me that fits with me and fits how I want to work. And particularly as a Black woman, I felt, like you said, there was much more to just parents and children. There was extended family, there were grandparents that were involved in parenting and caring and raising children into healthy adults. And so the family therapy training gave me that training, gave me that theory to be
Yeah.
able to practice with other people, and not just, the child in the room, but to involve other people, even the professionals that were involved, teachers, speaking and consulting with teachers, speaking and consulting with social workers and other professionals that were involved with the family, so that it's not just an isolated journey that they're going on.
Yeah, absolutely. Because, for example, in Ayurveda, which is Indian holistic system, it
Mm-hmm.
talks about the health of whenever your health is affected, it's not just only you who is affected. Everybody who's around you, everybody who's interacting with you is going to
Yes.
get the impact, right? If I have a headache, who am I going to shout at, right? I'm going to shout
Right.
children, I'm going to shout on my partner, I'm going to shout on my friends that I don't feel, because I'm not feeling well, right? So
Right.
that is what Ayurveda talks about, or natural medicine talks about holistic solutions, when we other people are there as well, so that other people, how can we do this so that it does not have an impact on others, so it doesn't bleed on to others and affect our
Yeah.
relationship with people.
Yes, absolutely, because it is about having that self-awareness about how we might acting in any given situation. But it is about paying attention to your relationships first and foremost, the relationships that you have, not only with yourself, but having, a relationship with those that are there to support you, and how they support you, because some people are very well meaning and want to support you, but sometimes the support that they have on offer is not the kind of support that maybe you want to, or want to take up, or is right for you at that moment. And so what a systemic approach does is it really kind of embeds that relational aspect of how we collaborate, how we work together
Mm,
as people. And even if we have different opinions and ways of doing things, what
yeah.
can we learn from other people, from other parents, from our colleagues, from our family,
Mm,
and how do we care for ourselves as well as other people within that?
yeah.
Because we've all got different kinds of love languages that are important to us, whether it's, some people privilege quality time,
Yeah.
gentle touch and affection, acts of service. There's different love languages that we all kind of privilege. And it's how do we show that love, care and support
Mm,
for each other in a way that it can be received
yeah.
by the other person as well. So yeah, it's really important to kind of look wider than just the individual, and have conversations, um,
Yeah.
that heal.
Absolutely. So in your work, is it mainly the person who is suffering who connects with you, or they reach out to you, or you get referrals from the doctors, GPs, consultants? How does
Yeah.
it work?
So we have several different avenues, and that was one of the reasons why I set up Mustard Seed as an organisation. What I was seeing as I was working for local authority and CAM services is
Mm,
that not everybody was coming through the door.
mm,
For support. So there was a certain section of the community that were very good at accessing
mm,
mental health services or counselling, family counselling. And so I set it up. I set up the organization, a community interest company, so that we could actually widen the net out. So we do have contracts that are commissioned by the local authority
Yeah.
or local authority or NHS. We do have sometimes people are referred through their school. So we have some counsellors that work in primary and secondary schools. We also have private individuals that might approach us and say, you know, can you work with us as a family or as a couple or as an individual? And we'll match the right kind of therapist for their situation and for who they are. And the other important thing is I want people to be able to bring the whole of them into the room. So holistic well-being. So I'm also a Christian minister. And so my values are very much aligned to that. And sometimes we are able to bring that aspect of our life into the consulting room, into the therapy. And so people are able to speak with me about their spiritual health, about how they feel. And yes, it is actually linked to Christianity from my perspective, but you know, people have all different kinds of faiths that I work with, but I know that, you know, I would want people to bring the whole of them into that consulting room, and whatever they feel they would like to talk about, then we'd talk about it. We talk about how maybe their health sometimes impacts their faith in a particular way. And vice versa. It can also be a strength for them. It can be a coping mechanism for them. There can be a community of support there. And many churches now do have their own counselling services, which I've helped to set up or have been a part of. And so that is something that's really important, that there's actually a community that would like to accept counselling and receive counselling for themselves, their families, that's also got that faith component in it as well.
Yeah, yeah. You know, you and I know that the mental health is a taboo topic. People don't like to talk about it. They don't want to approach it, or they don't want to be seen to be suffering from anything which is mental health related. And it is similar in Asian Indian background
Yeah,
culture. It's a big shameful thing if you have a
yeah.
family member who is struggling. People talk in hush hush words. So, how have you seen the change over the years? Because you've been doing this long time, how it was maybe 10 years ago, and now how is it now? And what
Right.
is the difference, in approach? And yeah, how open are people?
That's a very interesting question, because actually I do see some changes, but I also see some things that have been there for years. And so, like you say, there are certain sections of the community that sometimes are not able to access services as easily as other sections. And for Black and Asian, people that look like us, Black and Asian communities, the access to services is sometimes a lot more restricted. Sometimes we don't get to see people that look like us in the consulting room or even speak like us. There could be a language kind of barrier, although there are a few more, people who are trained to do that kind of interpretation or work in that way. There are more and more therapists
There are
being
more therapists, yes.
yeah, there are more therapists being trained and coming into the field, which is wonderful and great. But in terms of the outcomes, Black people and Asian people are still disproportionately represented. So they tend to access healthcare and mental health care at a much later stage. So it tends to be from that coercive perspective. So the sectioning and the admittance to hospital, that's still going on. There's still an overrepresentation in diagnosis of schizophrenia, for example. And sometimes people with emotional health and mental health issues end up going through the penal route. So they end up, they're being impacted by trauma and loss and death, but they end up going, it's their behavior then that is sanctioned, and they end up going into prison and not really addressing the underlying mental health issue. So they tend to get filtered off that way as opposed to a healthcare issue. And that is still a massive problem in our communities that we're having. And so we are trying to change that narrative. We are trying to, reduce the stigma, even amongst community members, about, how and what mental health is, what our emotional health and well-being is, and what it looks like. We are doing a lot of work. Those of us that are in the field of psychological healthcare and emotional healthcare, we're doing a lot of work to try and change that narrative. And I had the privilege to contribute a chapter to the International Handbook of Black Community Mental Health that was published in 2020. And there are so many authors, and the majority of those authors are people of color, so Black and Asian authors in that book. The editors are Ransor, Carberry, and Majors, and it was published in 2020. But I would encourage anybody that wants to know more about the theoretical background of Black mental health and the experience of Black and Asian people in the mental health system to get that book, because it really does show just the diversity of need and the diversity of approaches. So there's positive approaches and things like that in there as well. Of how we are as professionals to change our practice, how we are to pay attention to all the different intersectionalities that we come with, and identities that we believe ourselves to be. Something which the systemic world calls the social graces. So we look at things like gender and race and age and ability and culture, ethnicity, spirituality and sexuality. We look at all those kind of how they impact our emotional health and well-being, and how they also bring us strength and a sense of identity and purpose too.
I was going to say about culture, because there are so many things culturally which we think it is just part of culture. It's not even seen as anything which might be more sinister, because it is something that happens so often, whether it's even undertoned racism, even within a community, or there is undertone of being a little bit on the spectrum, for example, and how you get picked up on that, or how your family members react to that. And it is like, oh no, but we are just teasing him, without realizing the impact that it can have on that particular person. But I think culture has got a lot to do with a lot of things, because we grow up with certain ideas and we think this is normal, in our household or in our culture, this is just normal, but it is not, right?
Yes.
I find that, because you must hear about, and this is another topic, which is about honor killings and women who then end up being abused or killed by their family members. And they're just thinking that this is something that happens in our culture, but it is wrong. So how do you kind of talk about that? How do you raise awareness about that? Where people are thinking, no, but my father said that, but my minister said that, but my
Yes, absolutely. And I still think there is a lot of shared learning and what we might call psychoeducation that needs to go on about how culture impacts families and people that we're working with, but also how it impacts us as professionals as well, and how we then go on to practice with those families as well. So it's a two-way thing. It's about how culture shapes us, but culture shapes us as professionals, but it also shapes families and communities. And so one of the approaches that we use systemically in our conversations with people as a talking therapy is to be really curious with people about where ideas have come from and how can people behave in the way that they do and make the decisions that they do, and it brings it to their awareness as to how that might be different from other people may practice their parenting, their intimate relationships, their family relationships, their professional relationships, and then that leads us with that safe space to
Yeah.
really explore the narratives that they're telling themselves about themselves, because culture shapes our identity, and many of people with mental health challenges have a challenge with their identity, who they believe themselves to be, or the expectations of other people of who they should be or not be, for example. And so there becomes a conflict and a dilemma at the core of who we are, because, you know, society is saying this is who we are or should be, and we actually may believe something completely different. And it's
Yeah.
about helping people to realize who they actually are as physical, as emotional, and as spiritual human beings.
Yeah.
And spirituality is one of those things that many people do not really pay attention to as much, about who they are. And it's not about being linked to any particular faith or religion, but it's
No.
about who we are as a spiritual human being. It's part of our physiology.
Yeah.
As well. So identity is a major thing that that I explore with people, uh,
Hmm.
consulting room as well.
Right.
Yeah,
No, that is just fascinating because it is then linked to everything else. It is how also you view your health, for example. How in your work, what have you seen in terms of how women view their health? Because we know that women are bad at looking after their health, and also that their health is, it gets, it's like they're not the priority in the family. You have got children and you have got
yeah,
men in the family who are priority, and then women get left out. That it doesn't matter. I will go for my appointment
yeah,
last thing if I have the time to go for it. So what kind of trend do you see now, or maybe
yeah.
from earlier? Has it changed?
I think it's changing. I think there is a lot more information that we have about our physical health and our emotional health and taking care of ourselves, like we have, like I said earlier. We need to do more. I think again it comes with that perception of who we are, our identity, and who we are, and we want to be all things to all people, and that is how society sometimes shapes us. Again, we have a systemic concept called social construction, which is really about how our social worlds, our environment, our relationships, and they shape who we are, and they shape the meaning of who we believe ourselves to be, but also what we should be doing in life. And so there is this idea, particularly for professional women, for example, about the imposter syndrome, and how, even highly successful women will sometimes doubt their ability and their capacity to do more and be more. And sometimes we focus on productivity and what we're doing rather than who we are. That is that's a massive challenge. We're human beings, not human doings. So it's
That's a
about,
good one. That's a good one. Yeah,
yes,
absolutely. Yeah, yeah. To
yeah,
be and to be the healthiest self. But
yeah,
mental health is something, from natural medicine point of view or from
yeah,
Ayurvedic point of view, your mind is what is driving your body. So
yeah,
it is not the other way around. Most of the time, people see a physical disease, right? So because that's something that they can see, a pain that they experience. However,
yes,
it first starts from the mind. That's how we are
yeah,
told in Ayurveda, that it is first getting manifested here, and
right,
it is driving your whole life, really, because your mind and your mindset is basically driving your whole living, how you live and how you
yeah,
behave.
yeah,
And the importance of mind is just so huge. And it is so subtle and it is so tricky to be able to, yeah, to be able to have that kind of mindset where you are healthy and you
yeah,
you do suffer from certain conditions. So I know that in natural medicine, and for me personally and in my clinic, we do the work on the mind first. So mind comes first.
excellent,
How do
yeah,
we talk about your mental health? And And I also feel that, as you mentioned, it is not just only about productivity. We are looking at GDPs of all the countries. Are we looking at the, I don't know, there should be a monitor to check how happy we are, how satisfied we are, how mentally
Yes.
healthy we feel, rather
Yeah.
than only looking at GDP of a country.
Yes, and absolutely. So it's how we measure what good health is and looks like as well. So it's and some things are a little hard to measure. And I think science has taught us. Science is great, and we're learning more and more.
Yeah.
But there's a tendency to want to just compartmentalize things and label things in a nice, neat package. And human beings are not like, we're so diverse. We are our own theory, if you like. Not all
Yeah.
theories are going to fit in the same way. So even if you have a diagnosis of something, it's going to manifest very differently from person to person. We are so uniquely and wonderfully made as human beings,
Yeah.
and so sometimes that medical model does jar a bit against the kind of social models and the spiritual models and relational models of mental health as well. So the mind, yes, is very important. And we've got a physical mind, but we also have a spiritual mind. And the
Yeah.
same way that we get the information through our physical minds, through, our sight and feeling, touch, and, what we hear and things like that, we're also getting information into our spiritual mind as
Yeah.
well. And
Intuitively.
it's important to feed our spirit as well with all those positive things in life, like you were saying earlier, things that motivate us and things that bring us that passion, things that give us that peace in life. It's really important to kind of think about, our spirit and our spiritual mind, our visions, our dreams. These are all kind of communication patterns in our spirit. We see things and we hear things. Other people may not see them, but we
Yeah.
can see and hear them. And so we're hearing voices and we're hearing narratives, and we're seeing visions, and we're creating a life for ourselves based on those visions. Can be positive or negative,
Yeah.
but we're building our life in unseen ways, as well as the things that can be measured,
Yeah.
and compartmentalized and things like that as well.
Yeah, yeah. I think this compartmentalization is an issue overall. I think the way allopathic medicine is, and the way the modern drug medicine works is like, okay, if you don't fit this square box, then you don't have this thing. But then what do I have? Like my own mother, whole life, she suffered from some kind of pain here on the left, right? So something like trigeminal neuralgia you have, because you have this big nerve that comes and it supplies to your jaw. But she was never diagnosed with trigeminal neuralgia, right? But she had some kind of pain, and
Right.
she took drugs for probably 40 years of her life, all the drugs related to mind, and mind numbing drugs, really, which had a devastating impact later in her life. But it is because medicine, or modern drug medicine, is trying to put us people into these neat boxes, and we are not like that. There are shades of gray in between, and we overlap in so many ways, and so many things are so subjective, which is why we need some specific things, like what drugs can do, painkillers can do, or antibiotics can do. We need those. But at the
Yeah.
same time, I find if we have then a holistic approach, we have approach from every other angle, we can do a great service for the health of the people, which is
Yes.
which is
Yes.
not happening. And especially, I think, especially with mental health, especially with things to do with mind, it's just so difficult to diagnose as well.
Yeah. Yes, it is, and yeah, it really can be. And when I was working a lot with, and when I do work a lot with children and families, I think sometimes that the diagnosis can be very helpful for some people, because they kind of feel, this is kind of an area that I need to know. I need some kind of safe uncertainty, as we might kind of describe it. It's there's a level of knowing,
direction, which way am I
yeah,
looking?
a level of direction,
Yeah,
and that can be really helpful. But also it is about that, even with the diagnosis, we want to encourage people to live beyond that diagnosis, because they're more than whatever that diagnosis is. We have more to us, more in terms of our personality, our motivations, our skills and talents, more than. And so we do see many people that even with the diagnosis, they're doing things that maybe people may not have anticipated they could or would do.
yeah, yeah,
For example, being on the spectrum, autistic spectrum, and they're really doing, some neurodiverse people are doing some really marvelous things in
yeah,
one area,
yeah,
geniuses in, particular area of certain things. It's not just about the deficits. It's not just about what they can't do, which is what diagnosis tends to point out. Can't do A, B, C, or D, but what can they do? Let's work with a strengths-based model of mental health and look at what people can do, and what are their skills and their talents and their uniqueness about them, more
yeah.
than the deficit.
Absolutely. I think that it's about enabling them, not disabling them, not making this as an excuse. Okay, because I have that, I can't do this. It's like, no, because you have that, you can do this thing so well,
Yes,
so that they feel empowered, um,
yes,
despite whatever the challenges. And I think we all have challenges in different ways. It may not be mental health, it may be financial health, it may be something else to do with our physical ability, and everybody is so diverse. And it is great that you pointed out how can we, and also it makes it more inclusive, right? When
yes.
you talking and enabling someone, they feel that, okay, and yes, I can do these things better, doesn't matter if I can't do certain other things, and they feel good about themselves, and they are happy then to go and do better things with their life as well.
Right, absolutely. I use an acronym in how I work, of peace, because we all want peace, in our mind, in our relationships, in our environment. We want peace, and the acronym, the P stands for purpose. We all need to know our purpose, our unique purpose in life, and head towards that, and
Yeah,
do things that motivate us. We want to be empowered, like we said before, and feel confident about the decisions that we're making. And when we are in that kind of peaceful place and feel empowered and confident, we're much more able to make better, more quality decisions about our life and our direction as well.
yeah,
It is also about taking the action. So the A is for action, and what we do differently. I think it was Einstein that said, you know, doing the same things over and over again and expecting a different result is the definition of insanity. So sometimes we've got to try something different. We've got to take some kind of action to do something, to learn something new, in order to have a different outcome as well.
yeah,
C, like we've also mentioned, the care is very important. So not just caring for others, but caring for ourselves as well. They
yeah,
always tell us on the airplane to put our own mask on first before we help somebody else. And so I always tell parents and people to make sure that they fill up their own cup, and that they're able to more and better help other people,
hmm,
in their family and in their close relationships, once they are full and
hmm,
living the best life that they can. And then the E, the emotional energy. Our feelings can work for us or against us. We're going to have feelings, we're going to have emotions,
yeah,
about, they are the fuel to our behavior. So it can ramp it up in either a positive or negative way, but
yeah.
they are the fuel to our behavior. So it's really important to have all these different things and think about all these different acronyms of peace, purpose, empowerment, action, care, and emotional energy. To have peace of mind, we need to focus on these 5 things in our life, and
That's wonderful.
how they bring us that peace and joy.
Yeah, yeah, we definitely need peace and all of those things that each of those alphabets mean. We need all of that. I have a question related to, because I work obviously with a lot of women who have gynae issues, and they're trying to
Yeah,
get pregnant, and also I'm doing a lot of work with rejuvenation and how to rejuvenate your health, and you have health forever. So what
yeah.
kind of challenges you see with, let's say, women who are trying to get pregnant, if you have come across anything like that, or with mothers, let's say?
Yeah, so yeah, there have been a few families, couples that I've worked with, and again, there's so much. Sometimes there's a lot of stigma that is attached from the wider community with not having a child, and I think that is the biggest one of the biggest huge challenges that uh, women or couples may come with, that are finding it difficult to conceive. The expectations of family members, which is again linked very much to identity, in particular as a woman,
Yeah.
and authority, for men. So that when they feel that those things are challenged, that's
Mm.
where it can cause that kind of emotional turmoil, that we don't have a child, we really want a child, we can provide that loving and caring home
Mm. Mm.
for a child. So yeah, it's a huge challenge to identity. It's a huge challenge to
Yeah.
maintaining peace in life, as well.
Yeah.
It is about helping them to yeah, look at that, as you do, look at kind of the holistic healthcare.
Yeah.
So not just the nuts and bolts of what may be happening in their physical bodies, but
Yeah.
also what may be happening in their mind, and how they can find that peace and joy until such a time as they conceive, how they can still find peace and joy in relationships and the things that they do,
Mm.
until they conceive, if conception is an option for them.
Yeah.
It may not be, it may turn out not to be an option, but
Yeah.
yeah, how can you find peace in other things as well in the meantime, because we all live in the meantime.
Yeah, while it is happening. And also, one of the things that I'm doing with the events that we are doing this year is to talk about emotional health. How
Yeah,
can we heal from certain things? And one
yeah,
of the things that I find is that, one, we don't talk about enough about emotional health. Secondly, we're not doing enough to heal from trauma.
yes,
For example, the trauma of losing a baby, for the trauma of also postnatal depression, for example,
yeah,
is a huge trauma for women.
mhm,
So, what is happening to their mental health at that time? Uh,
right,
and I also feel that, and again, this is, I'm only talking about those women because I work with them, but it is probably applicable to other areas as well, that we are not supporting women when they are pregnant. We are not supporting them enough. There are some antenatal classes, there are some stuff that we are doing, but we are not doing anything related to relationship. We're not doing anything related to how
right,
life is going to change for you, how your mind is going to cope with this, which is why
right,
we see so much postnatal depression afterwards, because women and couples cannot cope with having a child, because it is taxing on everything that you have,
yeah.
including relationship. So, is there any work that you do? Is there anything that you are doing, or you have had patients or clients?
Yeah, so I have done some work with another organization that specifically looks at the kind of healthcare aspects for new parents.
Yeah.
And you may know there is a local review happening on maternity and post that care, the whole care system around that. There's a big review being undertaken by Donna Ockenden.
Hmm.
And so this organization we partnered with, and we did some equality, diversity, and inclusion training with the members of staff
Hmm.
that were or that are working in that field, in maternity services and early child mental health services.
Hmm.
And we've got, that's a training that we continue to roll out and can do it face to face and online, particularly looking at the experiences of baby loss as
Yeah.
well.
Yeah.
And the impact of that, particular kinds of bereavement, and all the things that happens around that, and how they're treated, how professionals treat and care for, parents that have lost a child as well. It's so important, and there have been some negative experiences of how parents have not been cared
Oh,
for
absolutely. Yes,
through
yes.
that process. So we do that in terms of training. We do other training for parents. So I have a peaceful parenting course that I run online
I
and
like
face to
that.
face.
Peaceful parent. There is
Peaceful
nothing like.
parenting, yes. So I've done it both online and face to face. A couple of schools, church organisations, and other people have attended those programs. And we look at managing challenging behaviour. We look at behaviour as a communication. We look at things like, our love languages and how we care for people in close and intimate relationships. And, because no one teaches us how to be a parent. We just have to figure it out ourselves. And there's so many, obstacles in this day and age that we come up with.
The biggest job in the world, and nobody trains you for it. There is
Yeah,
no,
absolutely.
people just think that, oh, my parents did it, so I will be able to do. And then they find, and it is very challenging. I'm a parent, I know how challenging it is. And
Absolutely.
uh, especially I feel as a conscious parent, I'm constantly reviewing my own behavior, if I'm how I speak to them, what effect it might have on them. And I'm constantly thinking about that, so that I am also developing with them, as they are also developing from babies to now they're 16-year-old, and learning about all of this is so crucial for us to, and not just in parenting, but in every relationship, whether it's a parent with their child, or in
Yeah,
organizations where we are communicating and we are able to understand other person's emotions and their emotional needs,
right.
also that we are able to communicate. I feel, and I've seen this firsthand experience with family members as well as with patients, that what happens when we don't communicate, what happens when we are
Yeah,
not expressing our emotional needs, and that has an impact on our mental health straight away, and how
absolutely.
it has an impact on your spirit, you know
Absolutely. And yes, we start to receive and even tell ourselves certain things about communication, or the people that we want that closer relationship or connection with, and we start to tell ourselves these narratives and rehearsing those negative narratives over and over and over again in our mind about how things are going wrong, and focus on how things are going wrong, and we get more of what we focus on. So things continue, if you like, to go in the same way. So it is very important, to think about, what we're thinking about at the end of the day, and to try and to change those thoughts to more helpful ones,
yeah
that serve us and motivate us,
yes.
as well. So yeah.
So tell me also, how long generally do you see, or what is the time scale or duration that people, you would recommend should go through some program or some kind of
Yeah.
help that they're requiring? And yeah, how would that
Yeah.
practically, how would that work?
So one of the adult projects that we've got, we're doing six sessions, because it's more of an early help
Mm,
kind of counselling support service.
yeah.
So we're kind of using a 6 session model in that instance. For a
Mm,
more trauma informed approach, it's going to be much longer,
great.
and sometimes you can't really put a number on the sessions, because
Yeah.
sometimes people will come and they say, I want to work through these issues, communication, feelings, unhelpful thoughts, or whatever it is they want to work through,
Yeah.
in those sessions. And so we may have a goal to work with, and we'll say, okay, let's see how we go for 12 sessions, and then let's review how far we've got in you addressing the issues that you came with. Sometimes those issues will change and other things will pop up along the way, and then we'll need to continue, or more work is needed. But generally, for a trauma informed approach, you're looking at a much longer time. There
Mm,
was one person that I was working with in the pandemic, and they had some physical health issues which affected their vocabulary. So and I was working with them for, I think I think it was about a year. I was working with them, and
Yeah.
they got to a point where they felt, yeah, actually, I think I'm good to go now. I think I have enough resources, enough coping skills, enough insight that I've developed over this past year of working with you, that I can take it from here.
Yeah.
And we always want the people that we work with to come to their own evaluation of what is useful.
Yeah.
In some cases, it's about finding the right fit, because in some cases people might think, actually, I'm not sure this is the kind of therapy that I want, or excuse me, oh, excuse me, or if we are the right fit as people, as therapists, because it's a very personal thing
It,
to do. And so sometimes people do say, actually, I'm not sure, this is working for me, and maybe they need to move to somebody else as well. That is okay as well. The authority, the agency, and the autonomy of the people that we work with is so important. So
yeah.
they define what success looks like, and they define who's best to work with them. And that's the great thing about working independently and not as part, if you like, of a statutory service,
Yeah.
because we can decide and they can decide who they work with.
Yeah, yeah. No, that is great. And I think that's where the subjectivity comes, somebody who needs it probably few sessions, and then some people who need it longer. And yes, I feel the longer or the chronic the trauma is, the
Yeah,
probably need much longer time.
yeah,
Um, you know, and is there any therapy that you advise, apart from, of course, psychotherapy, any other physical therapy, body therapy? I work with therapy. So we have
yeah.
that chat before as well. But is there anything, or do people sometimes say, can I do some other therapy or body, massage, for example?
Yeah,
So,
and there are absolutely so many therapies out there to choose from, but many people don't know what they are, or the types of, what they include, or what even you do in that. So I belong to the group of talking therapies, of which, we've got family therapy, cognitive behavioral therapy, but there's some non-talking therapies, which like art therapy, you've got music therapy,
that's nice.
drama therapy. There's all kinds of different therapeutic approaches that one could take and use. And what is also growing a lot of momentum at the moment is something called social prescribing.
Okay.
So actually, that's about doing positive activities in the community that can be very therapeutic for somebody. So it may even be joining a club, or doing a sport, or doing some art activities, or a social group.
Knitting club.
Yes, absolutely. A knitting club that can be very therapeutic. It can get people talking informally together in groups,
Yep.
and reduce that isolation that people often feel,
Yep.
particularly when they've got mental health issues. It tends to come back to, and that's what part of depression is. The focus is on the self. It
Yeah.
gets them into social situations, can relieve anxiety because they're able to navigate that social situation. So social prescribing, doing everyday activities in the community, walking, talking, getting out in the environment, meditating outside, all that kind of thing
Yeah.
can be very therapeutic and healing for people.
Yeah, yeah. That is great. It's good to hear there are other therapies. And yeah, I mean, I'm an artist, so I love art therapy, to play with
Right,
colors. It would be so lovely. And so for me, that would be really therapeutic, to be surrounded by artists and other people. Everybody's an artist in their own way, by the way.
right, exactly, exactly.
Yes. So tell me, before we kind of go, we have got about 10 minutes. Why do you think there is more mental health issues, or do you think there are more mental health issues, or that we are, diagnosing them more, or we are seeing them more now as compared to before, or that there
Yeah.
are a lot of us on the planet and that's why we are seeing more of mental health?
Yes. Yes, I think all of what you said is true. In some shape or form, we are seeing more. There is more because of how society has changed. One of
Yeah.
the big impacts, for example, on young people is the introduction of social media and access to social media sites and the things that are posted
Yeah.
on there. That's a massive change and a massive impact to many young people. They get a lot of positives out of social media as well and are able to connect and see, positive images. But there's also a whole world of negative things and negative influences on social media as well. So we are seeing more children, young people impacted by being on certain social media sites and groups as well.
Yeah.
And then parents having to navigate or try and limit or try and monitor what's happening, which is very, very hard because they're all individual accounts and all of that. And most people these days have a phone from, an early age. And, how do you monitor what's age appropriate? There are different things that parents can do to kind of block certain sites, but still they can get access to a lot of unhelpful material. I also think we are, learning a lot more about mental and emotional well-being as a society as well. We're learning more, and again, it could be the influence of social media and access to information through the internet itself. We can Google anything we want to know about, and many parents come and say, I've researched Dr. Google, and this is what I think they've got, or this is what I think is going on. And we have to have a conversation about, from our professional standpoint, about what actually might be going on. But yeah, there's all kinds of information and learning that we can now access through the internet. So there is that as well. Yeah, and just the pressures of society. We've come through a pandemic, and one of the things, there's so many things that the pandemic has left behind, on top of like the economic downturn and all of that. There's the emotional downturn. There are many more people, for example, experiencing eating disorders as a result, depression, isolation, lots of negative things. Yes, there were some positive changes that people made and decisions that people made as a result of, the pandemic, but there are also a lot more adverse effects on our mental health because of it as well. And I think we'll see that for a long time really coming.
There's a long time to go. Yeah. So,
we've still got a long time.
Thank you. One last question. How do you relax and how are you looking after your mental health?
Good question. I do sometimes get out of
Give
balance
us the
as people around me. Usually the first thing people will say to me is, I know you're busy, but
yes.
Because I am doing so many things. But one thing I really love to do is I do love to travel. And so I really, and to see other cultures and experience other cultures. So I did go on mission earlier this year. I went to Kenya and it was absolutely wonderful. So mission for me isn't, even though I'm working and I'm preaching and teaching, it's not just about that. For me, it was also an opportunity to relax and to see other cultures and to meet new people and all of that as well. New environment, to be in the sun. I love the sun. So I love to go to hot countries and there was so much sun there. So I do that. I have recently restarted my my gym, going to the gym and sauna and swim program. Because when I came back from Kenya, I was like, oh, this weather, I need some heat in my bones. And so I went to the sauna and then I just started the whole routine again, getting back to the gym. I do like to socialize. So I like to go out and watch films or see plays and different things like that. And actually my church community is a huge social event. So I do get to socialize and relax, when I go to church on a Sunday. And that's a wonderful, relaxing social environment for me as well. So there's lots of different things that I do. I might do some biblical meditation sometimes. I read. There's lots of different things that I might do at different times that I have access to as well.
Yeah.
Yeah.
Because I feel it's important for us as practitioners to do what we preach, right? So that we are not
Right.
just telling it to others, we are
Yes.
applying the same principle in our life. And it's fine to be busy, but as long as you know
Yes.
when to rebalance and recalibrate and
Abs-
re-energize yourself.
absolutely.
So it is
And
wonderful to hear.
yes, yes. And one of the other things that I have also implemented is taking a Sabbath, if you like. So as far as possible, and it doesn't happen every week, but
Yeah,
as far as possible, I switch off on a Friday and I try to have the Saturday completely just as a day of relaxation. So I try and get everything done in the week, because I know that obviously on a Sunday sometimes I'm serving
yeah,
the congregation. Um, so yes, I try to get my work done, and I am flexible because I work for myself. So
yeah,
even in some of that Monday to Friday time, or Monday to Thursday time usually, there are moments where I'm not working,
yeah.
so I am a bit more flexible in my working pattern. So sometimes I'm just taking time out. I'm not doing anything in the
Yeah.
week, but most people assume I'm working. So yeah,
Yes, but that's the beauty of flexible work and working for yourself
yeah,
also. But it is important to take that time out while we talk about mental health.
yes,
I think it is balance is, for me, balance is to know when you are unbalanced, to know when you are
yes,
your whack, and to actually bring yourself back into, and the means then to do that. You mentioned traveling, you mentioned doing your ministerial services, and different other people may have something else that they do. But it is because one of the things that happens with health is, and mental health same, is that most people don't know when it is out of balance. It is
right,
only when it is too far out, and they are seeing the web. I don't know why this is happening. Oh, I don't know why my digestion is
yes,
so out of place. Because you're eating so late at night. But it is knowing those signs is so crucial, because then you can come back to yourself much
right.
faster.
Right, absolutely. So that is one of the core themes that we may have to work on in any therapy situation. That self-awareness is so key, like you say, to
Yeah,
understanding who we are. And as Christians, we have, or we believe in the Holy Spirit, which is like our self-awareness GPS
yeah, yeah,
that tells us, kind of what's going on inside of ourselves. It's like the God within that tells us what we're doing. And so that's really important, that when we get those messages
yeah.
about actually this doesn't feel right, or I'm out of balance, or I'm feeling overwhelmed, that we pay attention to it and we do something about it. We act and get back to that place of peace that we need to get back to.
This is wonderful. We can keep talking, and I know that we're going to do some work together as well,
We
so
are,
that we
yes,
can do some more holistic work, and give people more tools in terms of natural medicine as well, what they can do. But
yes,
this is amazing, and I'm just loving these conversations every week, because there is so much to explore and so many ways we can tackle health issues and talk about them. So you are doing
yes.
great work,
Thank you.
Maureen, and it's wonderful to be connected with you. Thank you for sharing your time today
Thank you.
and giving your wisdom to all of us.
Yes, it's been wonderful. Thank you so much for the invitation, Dr. Ashish.
And please share when I'm going to share the links after.
Yes,
Please share all your links and social media and how people can get hold of you, and also the book you mentioned, so that the
yes,
more people can get to see it.
absolutely. I definitely will. Thank you so much.
All right, and thank you everybody for watching. Thank you. Bye
Thank
bye.
you. Take care. Bye bye.